So let's look at the upper GI bleed. Okay. What happens in upper GI bleed? Patient may present with vomiting blood. Okay. Patient present with vomiting. Patient will present with dizziness. Patient may present with feeling unwell. Okay. So how we start? Airway. Hello, Mr. Brown. How are you doing? Doctor, I'm not feeling well. Okay. So what do you mean not feeling well? I'm feeling dizzy. Yeah, I'm feeling dizzy. Okay, so let me look at the monitor. Since the patient is talking, the airway is patent. Okay. Let me look at your monitor. Yeah, your breathing rate is high, oxygen is low. Again, same, everything is abnormal. So you're going to give in here high flow oxygen because oxygen is low. Now, generally, what is low oxygen? Less than 94% oxygen on air, we need to give it, oxygen. If it's less than 94 saturations, we need to give oxygen. Okay, so we give oxygen in here, then the window is open for the history. Is feeling dizzy, just very focused. When did your dizziness start? Okay, 6 hours ago, yesterday. Okay, any other problems? Yes, I'm vomiting. Okay, how many times have you vomited? Is there blood in your vomit? Okay, have you vomited while in hospital? Then you look around. When you look around, you may find a bowl of vomit. Okay, then when you look into it, you're gonna find it, there's a vomit with blood. Okay, so now you need to find the differentials. What are the differentials for vomiting? Yeah, peptic ulcer disease. Do you normally suffer from indigestion? Have you ever had some investigations done, such as an endoscopy? Yes, you had an endoscopy. When was it done? And what were the results? Were you placed on any treatment or any medications? What did they found as a cause? Yeah, so this particular patient had a previous endoscopy. He has a history of peptic ulcer disease. Okay, so we need to get that history. Alcohol. Okay, do you drink alcohol? Do you have liver problems? Have you noticed any yellowish discoloration in your skin, any jaundice anywhere? Cancers, gastric cancer, esophageal cancer, any weight loss, difficulty swallowing, abdominal pains. Now, upper GI bleed will cause melena. Ask about any black stools. Yeah, any black stools. So we need to look some differentials. Medication. Do you take any over-the-counter medication? Yeah, ibuprofen over-the-counter. That can cause of perforation and of course bleeding. Okay, then the rest, any medical problems, regular medication, allergies, look at the wristband, running a temperature. That's it. So if I ask about a specific history, the specific history is about his vomiting, indigestion, previous investigation. Yeah, the previous investigation, endoscopy done 48 hours ago. It's going to be recent endoscopy. Yesterday or 48 hours ago, and he was told he has got peptic ulcer. He went to home, he started vomiting again. Okay, good. And on the setup, you have got a bowl with a vomit. So what you're going to do next, respiratory examination. What do you find? Normal. There's nothing, it's an upper GI bleed, so respiratory examination would be normal. What is next? There's nothing to manage in here because the examination was normal. Okay, we need still a chest x-ray and ABG. Saturations was less than 90%, 88, 99, 88, on air. So we need a chest x-ray and ABG as usual, always talking to the patient. Now come to circulation. Blood pressure is low, heart rate is high, sinus tachycardia. Now you need to check the capillary refill in here because the blood pressure is very low. The rest of assessment as usual. You auscultate, is vomiting blood, so you know it's not heart problems. You auscultate only on one position. You need a fluid ECG as usual. Okay, then when we come in here, yeah, we need an abdominal examination because he told you you've got a peptic ulcer. So I need to examine your tummy. You inspect and palpate. Where do you expect the problem? Epigastric area, but palpate everywhere. You need to look at your private area. You can check for melena. Okay, so check for melena. Does the patient have a catheter or not? Then we manage. Well, how do we manage? Circulation, IV line, send the bloods, routine blood test, group and save and cross match because there is a bleeding. Yeah, you need a group and save and cross match. Get IV fluids. Do we give IV fluid? Yes. How much? IV fluid start 1 liter in both arms. So it's aggressive IV fluids. Okay. Then what happens next after IV fluids? We go to D, disability. So the patient on AVPU system, my patient is alert because the patient is talking to you. Check the pupils, check the glucose. Okay, normal, normal. Review the treatment offered. Now, you have given oxygen, saturations have improved at B. Circulation, you've given IV fluids. Okay, you have given IV fluids, and then has the blood pressure improved? Yes, the blood pressure has improved, but it's slightly. It is still less than 90 systolic. So if the blood pressure improved, good. If the blood pressure does not improve, then of course we need to step up. How would you step up? So what you can see, the blood pressure, if it has not improved, it's less than 90 systolic, then you have to give what? Group O negative blood. In this particular case, they can simulate blood pressure, no significant improvement, still less than 90 systolic. So you're going to tell the patient, I'm going to give you group O negative blood because your blood pressure is very low. The examiner may ask how much fluid, how much blood are you going to give the patient? So to begin with, you give it 2 units of blood, okay? And then may repeat it if you needed to. So that is our D. Then you go to E, okay? We have already done the abdomen, and we have done already the external genitalia. What you're going to be doing next is just to look at the legs, inspect. Now, we have given the patient blood. They need to reassess how he's doing. He has improved well. Blood pressure now, it becomes 110/70, saturations back to normal. So we have stabilized the patient. What happens next is to explain to the patient what is happening. Okay, Mr. Brown, I've assessed you. You came in feeling unwell. You had some dizziness, you have been vomiting, okay? Your oxygen was low, your blood pressure was very low, okay? So, and you have been vomiting blood. I suspect you have what you call an upper GI bleed. What I simply mean is you are bleeding from your stomach or from your bowels. This is why you've been feeling dizzy and unwell. And this is likely to be from the peptic ulcers, which were found on previously endoscopy you had, or an endoscopy that you had, this most likely cause. Now we have given you fluids, you have given the blood transfusion, you have responded well, your blood pressure has improved. What we need to do, okay, we need to stop the bleed. So we're going to be referring to the gastroenterologist, the specialist. Usually they would perform an endoscopy within 4 hours to try and stop the bleeding. Okay, an endoscopy within 4 hours to stop the bleed. So we're going to refer you to the gastroenterologist. Okay, as usual, we have to keep monitoring your blood pressure, your heart rate, your oxygen, and then I'll talk to my seniors. If they'll suggest anything different from what I have told you, I will let you know.